Well, breast cancer is the most common form of cancer in women, with the exception of skin cancers here in the U.S. The disease accounts for about 30% of all new cancer diagnoses for women each year. So now medical professionals, they're working to revolutionize the way breast cancer is detected and risk is reduced. And joining me now with details on the study aimed at doing just that is Program Director and Genetic Counselor at Moores UCSD Cancer Center, Dr. Lisa Medlenski. Dr. Medlenski, thank you for joining us. We appreciate it.
Thank you for having me.
Let's talk a little bit about this WISDOM study. What is it and what are you trying to do with it?
Sure. So I think an item that's been in the news the last day or so has been the new guidelines for mammogram screening for what's been labeled as average risk women. And one of the challenges, of course, is who is average risk, who's higher than average and who's lower than average. And so the WISDOM study is aiming to test a more personalized approach to breast cancer screening. So the idea is that participants can choose to either stay with annual mammograms if they're over 40, you get to select if you prefer to do that, or you can choose to be part of what we're calling the personalized arm. The personalized arm includes genetic testing for the BRCA genes as well as other breast cancer genes. It includes a new way of looking at breast cancer genetic risk that's called a polygenic risk score. This is kind of the latest thing. And it includes the usual things that women are asked about when they're determining, when should they start their mammograms, how often should they go, reproductive factors, everything else. So the idea is in the personalized arm, we take all of this information and make a recommendation for screening. Some women will be higher than average, some women will be lower than average, and some will be average. The other innovative thing about the WISDOM study is we don't just tell you this is your risk and you stick with that for the rest of your life. We evaluate your risk factors every single year and make adjustments. So it's dynamic.
It's interesting because, like you said, they changed the guidelines. Women ages 40 and up must have a mammogram every other year. Mammograms, for the most part, have always been a great detector. Talk about the importance of having other tools.
Sure thing. So yeah, mammograms are always considered the standard. And one thing to keep in mind is that mammograms are a screening tool, right? So the screening means we take the whole population and we're looking to find disease that has not been symptomatic, not caused any lumps or bumps yet, and we apply that to everyone. So it does a pretty good job of catching a lot of cancers. It does miss some, and it does overdiagnose a few things. So there are other tools like ultrasounds, like breast MRI, and a lot of other new imaging technologies that are being developed right now that are very exciting. Really what we want to do is get to a point where we have ideal screening, which would mean women are getting the right screening test at the right time in their life, depending on their personalized level of risk.
It's interesting because when I went to see my doctor for my annual, and I'm going to share this with the whole world, my mother died of breast cancer. My aunt had a double mastectomy on my maternal side. I have had cancer before, and so when I sat down, they asked me a whole list of things and made me go through something I'd never gone through before. They asked me every question and then recommended me for genetic testing with you, ironically. And so there are certain risk factors that increase the risk assessment for women, isn't it?
Correct. So the ones we think of most are family history. That one is typically one of the first things that gets asked. And in general, the younger your relatives are when they were diagnosed with breast cancer, the more likely there is to be a genetic underlying predisposition, but not necessarily. Although, a lot of older women get breast cancer, sometimes we find a genetic cause, most of the time we do not. Your hormonal exposures over the course of your lifetime, so for example, how old were you when you had your first child? Have you taken any medications that might increase or decrease sort of the cumulative amount of estrogen you've had in your lifetime? Other things like prior breast biopsies. So most breast biopsies end up being benign, thankfully. But for some women who've had biopsies that show that the cells are kind of acting in an atypical way or what we call a proliferative way, that can be an important risk factor as well.
Can women take part in the study, in the WISDOM study?
Every woman between 30 and 74 who has never had breast cancer can join the study.
All right, Dr. Lisa Medlenski, thank you so much for coming in today. We appreciate it. Obviously, a lot of women are interested in finding out a little bit more and just the importance of our health. Thank you so much for joining us here at Fox 5.
Thanks for having me.
All right.